Being immersed in darkness, even for just a few brief seconds, can be an intimidating and frightening experience for many of us. But for 15 million people living on Australia's doorstep in developing Asia, this darkness is their life, or at least a blur of shapes and colours. 15 million people who make up half the world's blind. 15 million people who are destined for a lifetime of poverty. And 15 million people who are faced with the prospect of an early death. And the disturbing truth is that over 3/4 of that blindness could have been prevented or treated. It just should not be. I've been involved in blindness prevention for nearly half my life. I've taught in 10 developing countries in Asia. And for the past 7 years, I've run a blindness prevention organisation known as Sight for All. I call it my second full-time job. It's a job that pays me nothing, is all-consuming, and yet gives me the greatest reward. There have been 3 experiences that have had a powerful effect on me and on the direction of my career and ultimately my life, and I'd like to share those with you today. They're experiences that made me realise that as eye specialists we can provide high impact and sustainable solutions to help restore sight, alleviate poverty and save lives in some of the poorest countries in the world. The first experience came back in 2005. I was part of a team from the South Australian Institute of Ophthalmology undertaking a study with our colleagues in Myanmar, a study to determine the prevalence and causes of blindness in this country of over 50 million people. We discovered that the leading cause of blindness was cataract. Cataract is a clouding of the lens inside the eye that is responsible for half of the world's blindness and is the leading cause of blindness and a major contributor to poverty in many of the poorer countries in the world. The fact that cataract was the lead cause of blindness was not a surprise. But what did surprise us, however, was the actual level of blindness. Nearly 1 in every 10 adults in this study in central Myanmar were blind. This is a level perhaps 20 times that in Australia, and most were blind due to cataract. I was in my early 40s at the time, and every day I was seeing people my age, even younger, for several weeks, who were blind from cataract. I couldn't believe what I was seeing. I'd never experienced this sort of blindness back home in Australia. The reasons for such a high level of blindness in developing countries are many. The inability to afford the $40 or $50 for cataract surgery often comes high on the list. But what we found in this study was that many of the people who'd already had surgery were still blind. The doctors in this area were well trained, they were competent, but they didn't have the equipment to perform the surgery at the highest level to ensure the best results, to have any real impact on blindness. How frustrating, how soul-destroying for a trained professional. So it was this high level of treatable blindness amongst adults due to a lack of equipment, which was the first defining moment in my humanitarian career. Something needed to be done. So our team embarked on a strategy, a national blindness strategy to help improve cataract surgery rates and outcomes in this country through the delivery of equipment. We've recently finished the project, and over a 4-year period we delivered equipment, vital equipment and essential training to 32 eye centres across Myanmar. And there are now 32 eye centres performing high-level cataract surgery and having an impact on the daily lives of tens of thousands of people every year, and helping to improve life expectancy and alleviate poverty in one of the poorest countries in the world. The second experience came 2 years later in 2007. I was involved in another study in Myanmar, this time a study to determine the causes of blindness amongst children in the country. And what we found was once again a surprise. In fact, it was staggering. And it was the leading cause of blindness that had a powerful and profound impact on our team. It was measles. Imagine that many of you didn't even know that measles could cause blindness. Well, it sure can. This little boy is blind from measles. It's a pretty disturbing image. It's an image I took of one of the little boys during that study. This is a sign of a poor country, a country that's not been able to broadly vaccinate its children against communicable diseases such as measles, a country that at that time, back in 2007, was unable to protect its children from the blinding outcome of this entirely avoidable disease. It costs less than $1 to prevent measles in a child, less than $1 to prevent this. At every school for the blind that we visited during that study, we were surrounded by children that looked like this little boy. It was one of the most disturbing experiences of my life, and it made me realise that there's more to blindness than just cataracts, much more to blindness. And it was this high level of preventable blindness amongst children, due essentially to a lack of advocacy, which was the second defining moment in my humanitarian career. And yet again, something needed to be done. So we used the results of that study to persuade the authorities in Myanmar to train a children's eye specialist, a specialist that could not only treat children's eye diseases, but also advocate for children with blinding yet preventable diseases such as measles. Meet Dr. Tan Tuanong. Dr. Tan was a young eye specialist from Myanmar that spent a year with us at the Women's and Children's Hospital in Adelaide, training to be a children's eye specialist. And he returned home in 2010 as the very first in his country, the first for perhaps 20 million children. And we set him up in the country's first children's eye unit. Let's see how he's getting along.
I've been back in Myanmar for 5 years, and I'm treating about 20,000 children every year. Now I'm training my own children's eye specialist for other regions of the country.
Did you hear that? He's now treating 20,000 children every year. But even better, he's training his own colleagues so that they can treat children appropriately. And he's in fact just finished training the second children's eye specialist for the country. And it's about to embark on the training for the third, using the skills and knowledge that he acquired during his time here in Australia. It's now 5 years since that time, and our investment in Dr. Tan is now amounting to around about $1 per child. And this is getting less and less every year as he trains more specialists and they collectively treat more children. So it's a pretty powerful investment in the future of children and in the future of a country. Disturbingly, we found that measles was the leading cause of blindness amongst children in 2 other countries in which we were working, in Cambodia and in Laos. Amongst the sea of children in schools for the blind in these 3 countries, the sea of children who are blind from measles, we occasionally find a child who's blind, who is blind because they've never been tested for spectacles, because there's simply been no one there to provide that basic service. I'm now going to show you a video which was taken during our School for the Blind study in Laos in 2013.
Once he gets correct glasses, he can go back to his home. Thanks. Perfect. He likes those, doesn't he? He wants.
So the moment when that little boy says, wow, it just gives me goosebumps every time. It's an amazing moment to find these children, to provide them with spectacles and discharge them out of the School for the Blind, away from poverty, and back into the mainstream schooling system with all its profound advantages for their education and their future, their lives. So we've now trained and equipped children's eye specialists in 8 countries in Asia. Specialists who can now not only restore sight in children, but prevent children from being immersed in a lifetime of poverty. My chosen specialty in the field is something called Ophthalmic Oncology. It's a specialty that encompasses a range of vision and life-threatening eye cancers in both adults and children. I have the unpleasant task of having to remove eyes from young children with a rare but dangerous eye cancer called retinoblastoma. Imagine as a parent being told that your child's eye needs to be removed. It's a devastating moment. But fortunately, in our country, all of these children will survive. And it certainly makes me feel better about what I do. I've been involved in training in the management of retinoblastoma in a number of countries in Asia. And the third experience came in 2013 when I was teaching in one of our partner countries, a country with an established children's eye unit in a large and busy eye hospital in the capital city. In one day, I saw 12 children with retinoblastoma, and of these 12 children, a third were going to die. And they were going to die because the doctors at the centre didn't have the expertise or the understanding to be able to manage this complex disease. It wasn't their fault, they just simply hadn't had the training. I was upset. I was actually really angry. Back home, all of these kids would have survived. As doctors, it's our duty to preserve life. This little boy was one of the lucky ones. He was a 2-year-old with retinoblastoma, fortunately only affecting one eye. His mother was grief-stricken when she heard that the eye needed to come out, but she understood the importance of our advice. And the very next day, we removed his diseased and blind eye, an eye that would never see again, an eye that was threatening his life. And here he is, a year later. He wasn't at all happy to see me. I was the bad guy. But he was full of life and with a very happy mother. So it was this realisation that children were dying of an eye cancer which was entirely curable, which was a third defining moment in my humanitarian career. And yet again, something needed to be done. So after that harrowing week, we immediately arranged for the training of a retinoblastoma specialist from that country, from that eye centre. In fact, we've now arranged training for retinoblastoma specialists from countries across the region. So I'm delighted to be able to share with you now that we have specialists across Asia who are not only restoring sight in adults and children, and in turn alleviating poverty, but they are also saving lives. This slide depicts what a blind person might see. As you can appreciate, being blind doesn't always mean that the lights are out, that they're immersed in darkness, but it does mean that they can't see the faces of their family and friends. The opportunity to have a solid education and a well-paying job is extremely remote, and they're often destined to a life of poverty and faced with an early death. So when that veil of blindness is lifted, life takes on a whole new meaning. For the colleagues we're helping, our team at Sight for All, and the patients that we're all treating. Thank you.